Hi everyone, welcome to another Tooth Talk Thursdays. This is Dr. Sophia Beecher. Today we're going to just finish up our back to school series by talking about orthodontic problems. Okay, if you have an orthodontic problem, it means that you see a need for braces. So we're going to talk about some of the most common problems. So firstly, we're going to talk about crowding, or double row as we call it out here. Secondly, we're going to talk about buck teeth, or teeth with an increased overjet. That's a technical term. And thirdly, we're going to talk about a crossbite. And well, I don't really know any colloquial term for that, so we'll explain a little bit more about those. Now, when you have problems with the alignment of your teeth and jaws, apart from the fact that you may not be able to function properly, you may also have issues with self-confidence, right? And you'll find that a lot of people that have malaligned teeth won't, because they don't feel confident about their smile, they'll be less likely to take care of their teeth because of it. So first of all, why do we have malocclusion? That's what we call it, malocclusion. Well, it can be genetic. So for patients that have very, very small jaws, they cannot accommodate all of the teeth and they're more likely to have crowding, right? So it can be genetic. So you can have discrepancies in terms of the size of the jaws and how they relate to each other. You can have missing teeth, you can have an abundance of teeth, and all of those may cause orthodontic issues. Also, it can be caused with habits. So if your child has a thumb sucking habit or a finger sucking habit, for example, it will push the teeth forward and then you will get the buff teeth. Also, if the child sucks their tongue as well, it can push both top and bottom teeth forward, right? And that can cause a very protruded look. And so that's basically it. So in talking about the common problems, we're just going to give a brief overview of what's happening here. So we're going to talk about the common problems and if left untreated, what can happen. Okay? So for example, crowding or a double row, if you don't treat that, problems that can arise are gum issues, because when the teeth are not perfectly aligned, then there are plaque traps. Okay, so they trap food in those areas where they might be twisted, right? And it's very, very hard to clean through for the patient. It's even hard for us to clean when we're cleaning you, right? So if you leave it untreated, you can get cavities in those areas and you can get gum disease in those areas. Okay, so the next thing now is an increased overjet or buck teeth or buff teeth, however you call it. So if that's left untreated, you can have the child breaking their teeth, especially if they play contact sports. Because if the teeth are sticking far out of the mouth and the mouth can't close, then they're unprotected, right? So until that's corrected, we definitely would suggest a night guard for the, mouth guard for that child, right? A mouth guard for them to play sports. And in fact, if your child plays any kind of contact sport, they really should have a mouth guard. So broken teeth, that's one issue. Also, you may have gum issues if the lips can't close together. Alright, so the next thing we're going to talk about is a crossbite, which many people may not be familiar with. So the normal overlap of the teeth is like this. So the top overlap the bottom like this. So when you have a cross, simply means that the overlap is like that. Alright, so it can be in the front or it can be at the back. So if that's left untreated, you can have a fracture of the teeth, you can have jaw pain, you can have loosening of the teeth, and you can have issues where you grind your teeth to compensate for that. So what we do as a general dentist is that we refer you to licensed orthodontists. That's what we do. We ensure your hygiene is good, first of all, because you can't get braces if you have poor hygiene. So we ensure that you have had a recent cleaning, diagnostic x-rays to ensure you don't have any cavities that need to be taken care of, and we refer you to a licensed orthodontist. Alright, there are a lot of people doing braces in their car trunk, in barbershops, on their porches. Please stay away from fashion braces. Alright, they have never trained a day in their life. They will do more harm than good. okay, and it is just not worth it. If you have an orthodontic concern, yes, braces may be pricey, all right, but there are options, there are payment plans that can work out for you, and it's something that you can save towards if you consider it to be worth it. Okay, I have to run now, so have a good day and stay safe. Take care.